Yes, students. Last day we discussed about developmental disturbances affecting jaw. Now we are moving on to next section, that is developmental disturbances affecting tongue. What do you mean by developmental disturbances? Developmental disturbances or developmental anomalies are the defects which is resulted from any disturbances during development and growth of that particular organ. So we are discussing about developmental disturbances or developmental anomalies affecting tongue. That is, during development of tongue, any disturbances or any insult occurs in the development and growth of tongue. It will result in anomalies, and that is known as developmental anomalies, meaning tongue. The first anomaly we are discussing about is aglossia and microglossia syndrome. That is, it's very rare and is almost always associated with malformations in extremities, especially the hands, feet, cleft palate, and dental agency. Aglossia word meaning is absence of tongue, and microglossia means small tongue. Glossia, tongue. Aglossia, absence of tongue. Microglossia, micro means small, glossia means tongue. Hence, absence of small rudimentary tongue is aglossia and microglossia syndrome. This is due to lack of muscular stimulus between alveolar arches. This do not develop transversely, and the mandible does not grow in anterior direction, producing a result a severe dentoskeletal malocclusion. This is the cause of formation of aglossia or microglossia syndrome. Syndrome shows no predilection for gender, and there is no genetic implications. That is, it may be due to fetal cell traumatism in the first few weeks of gestation. That is, the cause for aglossia or microglossia may be due to any fetal cell traumatism occurs during the first week of gestation. There is no compromise in language or swallowing by this condition. Very rare condition, and there is no treatment is necessary for the microglossia or aglossia syndrome. Next, we move on to next anomaly, that is macroglossia. Other names for macroglossia are tongue hypertrophy, prolapses of the tongue, enlarged tongue, and pseudomacroglossia. Macroglossia word meaning is macro means large or big. Glossia means tongue, that is enlarged tongue. Macroglossia has been documented anatomically anomaly of several centuries, and the exact incidence of macroglossia is unknown. Some congenital syndrome are often expresses with macroglossia in their phenotypes. They are Down syndrome and Beckwith-Whiteman syndrome. These syndromes, with 97% is having macroglossia. The broadest categories of macroglossia are pseudomacroglossia as well as true macroglossia. True macroglossia is nothing but the macroglossia exists because of enlarged jaws and the tongue also enlarged. But pseudomicroglossia is an illusion. That is, the tongue is in normal size, but the mouth or jaw is very small. Hence, there is an illusion of enlarged tongue or protruded tongue from the small mouth, which is associated with your Down syndrome. Next is the physical examination of the oral cavity and head morphology is helpful to deduce true macroglossia from pseudomacroglossia. Severe retrognathia and unusually small maxillary or mandibular size may indicate it. In addition, Check tongue tone and mobility to rule out simple atonia or hypertonia indicating poor posturing of the tongue. This is commonly observed in Down syndrome. The treatment of macroglossia is surgical intervention. If this macroglossia is impaired functions like articulation, mastication, deglutition, and to protect the airway, we have to go for surgical intervention. Next anomaly is ankyloglossia or tongue tie. Ankyloglossia means which is something is stuck into the some base. Glossia is tongue. That is the base of the tongue or inferior frenulum attaches the bottom of the tongue and subsequently restricts the movement of the tongue. That is, tongue is fixed in the floor of the mouth. At one time, such restriction was believed to cause speech problems, and it was routine to clip the membranous frenulum to free the tongue. Springlectomy. That is, inferior frenulum is attached to the floor of the mouth. Hence, we can give an incision and remove that fixation, and we can improve the tongue function. Ankyloglossia occurs approximately 1.7% of all neonates, and there is no gender predilection. As we are growing, the frenulum lengthens and the normal tongue function is established. The criterion for diagnosis is based upon the tongue mobility. That is, no current specific indications for surgery or emphasis in either the dental or medical literature review. Simple incision of the frenulum may result in the development of scar tissue and further restriction of tongue movement. So, we have to take care while doing incision of the frenulum. Preventing speech defects or improving child's articulation may be another reason for surgical intervention. Hence, the treatment of choice is frenulectomy. Next is the cleft tongue. While developing of the tongue, there is fusion of two lateral lingual swellings. If it does not occur, it will result in a completely cleft or bifid tongue. A partially cleft tongue is considered to be more common and is manifested as simple or deep groove in the midline of the dorsal surface. The partial cleft results because of incomplete merging of two lateral swellings. It is having a clinical significance. That is, there will be lodgement of food debris, microorganism, and may causes further irritations. These are the pictures which showing cleft tongue and bifidness of the tongue. Next anomaly we are facing is fissured tongue, which is also known by the name scrotal tongue lingua plicatum. Fissured tongue is a condition frequently seen in general population and is characterized by grooves that vary in depth and are noted along the dorsal and lateral aspect of the tongue. It is nothing but there is presence of deep groove within the lateral and dorsal surface of the tongue, and its definitive etiology is also unknown. There may be a chance of polygenic mode of inheritance and seen in same families. Patients are usually asymptomatic. That is, the condition is initially noted during your routine intraoral examination, and it is seen in a syndrome known as Merkel cell Rosenthal syndrome and also in Down syndrome, and it may be associated with geographic tongue. Merkel cell Rosenthal syndrome is a rare condition consisting of triad, that is having lip or facial swelling, facial nerve paralysis, and the fissured tongue. That is, Merkel cell Rosenthal syndrome has a triad of symptoms. That is, first one is lip or facial swelling. Next is the facial nerve paralysis and the fissured tongue. The etiology is also unknown. Fissure tongue is totally benign condition and is considered by most of the variant of normal tongue architecture. It is a benign condition and it is normally considered as a normal tongue architecture. No predilection for any particular race, and some reports have shown male predilections. Although fissure tongue may be diagnosed initially during childhood, more frequently diagnosed during adulthood. There is prominence of this condition can be seen in as the increases in age. The lesion is usually asymptomatic unless debris or any microorganisms are entrapped within it. On clinical examination, fissure tongue affects the dorsum and often extend to lateral surface. The depth of the fissures varies from about 6 mm in diameter, and the fissures and grooves may be interconnected, separating the tongue dorsum into what may appear to be several lobules. That is, the dorsum of the tongue may be appears as several lobules. Although a specific etiology has not been elicited, a polygenic mode of inheritance is seen, and it can be seen in same family members. Biopsy is rarely performed with fissure tongue. Histologic examination shows there is thickness of lamina propria, loss of filiform papillae of the surface mucosa, and hypoplasia of red apex. There may be neutrophilic microabscess within the epithelium, and seen mixed inflammatory infiltrate. There is no definitive treatment is necessary for this condition. These are the lesions which is associated with developmental anomaly of tongue. We are concluding this session. Thank you.